First Ladies of various countries present, particularly the First Lady of the Republic of Turkey, Her Excellency Emine Dogan, the First Lady of the Republic of Sierra Leone, Her Excellency Fatima Madabio, First Lady of the Republic of the Gambia, Her Excellency Fatoumata Barbaro, representative of the First Lady of the Islamic Republic of Mauritania, representative of the First Lady of Uganda, and I believe Mozambique will be joining us for dinner because we've had quite a long week. The Honorable Speaker of the House of Representatives and his lovely wife, Right Honorable Dr. Tajuddin Abbas, I want to particularly thank you because I didn't talk to you until yesterday. Thank you so much. And other members of the House of Representatives here present, wives of members of the National Assembly members that are here, wives of the state governors and first ladies of the various states present, honorable ministers, particularly the Honorable Minister of Health and Social Welfare for State, Dr. Tunji Alausa, Honorable Minister of the Federal Capital Territory, host city, wives of honorable members here present, wives of service chiefs, Secretary General of the Organization of Islamic Communities, represented by His Excellency Dr. Ahmad Sengedo, members of the diplomatic community, heads of government agencies and parastatals, development partners, WHO, IAEA, ISDB, NGOs and CBOs here present, Your Highnesses, members of the press, distinguished delegates from the OIC member states, ladies and gentlemen, I am most delighted to address you all at the opening ceremony of the Organization of the Islamic Cooperation, OIC, on promoting cancer awareness and advocacy programs in the OIC African member states. I am honored to host the third edition of the high-level regional seminar with the theme, Innovative Approaches to Cancer and Early Detection. This event is intended to provide global experts and the first ladies of the OIC African member states with the opportunity to discuss and make recommendations on the initiatives to promote effective cancer control and prevention in the African sub-region. The third edition of the OIC High-Level Regional Seminar is timely, as it coincides with the period when we are planning to commemorate the first anniversary of the administration of His Excellency President Bola Ahmed Tinubu, GCFR, who within 11 months of assumption of office as President and Commander-in-Chief of the Armed Forces in Nigeria has made tremendous impact in the fight against cancer in Nigeria. Sequel to the brief of Mr. President by the Coordinating Minister of Health and Social Welfare and his team, immediately approved the expansion of access to cancer treatment and care, in particular by upgrading 6 federal tertiary health institutions with modern brachytherapy and nuclear medicine equipment and other ancillary and complementary facilities. Due to President Bola Ahmed Tinubu GCFR's commitment to addressing cancer care in Nigeria, he ensured that the health sector was allocated more funds in the 2024 budget. While Mr. President has fully taken the diagnostic and treatment component of cancer care I am leading the advocacy to promote innovative approaches to cancer prevention and early detection. This is based on my belief in saying that prevention is better and cheaper than cure. Some studies in Nigeria have reported that as high as 60 to 80% of cancer patients in Nigeria present to health facilities at stage 3 or 4, which makes treatment outcomes very poor. My major interest is to reduce the prevalence of late presentation and in order to improve treatment outcomes. Reports from various cancer registries in the country, which have been corroborated by Globocon data reports, showed that there were 127,763 new cancer cases and 79,542 deaths within the year, and also the prevalent cases of cancer over a period of 5 years in the country stood at 269,109. Globocon shows that cervical cancer is the second commonest cancer among women in Nigeria. Fortunately, it is preventable and curable when detected early. This has led to my stand in championing preventive measures and early detection approach to all preventable and curable cancers in Nigeria. It was on this premise that I launched the introduction of human papillomavirus vaccine for the prevention of cervical cancer in Nigeria on the 24th October 2023. This marked the beginning of the inclusion of HPV vaccine into the routine immunization by the National Primary Health Care Development Agency. I am aware that over 9 million girls have been fully immunized since the launch. I want to use this opportunity to reassure Nigerians that cancer is safe, the vaccine is safe and very helpful to prevent cancer of the cervix in our young girls. I want to commend the efforts of different ministries, departments and agencies of government, bilateral and multilateral agencies, as well as non-governmental organizations and stakeholders that have contributed in the fight against cancer in Nigeria. My office will continue to partner with all stakeholders to address the challenges of late presentation of cancer cases to health facilities across the country. We will leverage on the existing health infrastructure and other stakeholders, including local and international non-governmental organizations, to reverse the trend of cancer incidence in Nigeria. At this juncture, I want to thank the First Lady of Turkey for being the first to host the First Ladies of OIC member states back at OIC Summit in 2016. I am grateful for her meeting despite the short notice during my visit to Turkey on official assignment. And I particularly want to thank you so much for the experience and for the love for our continent. You showed this by describing in your book that Africa is the rising sun. I want to thank you. We love you. Even for having an African center in Ankara, I'm here to visit. You came in here reminding us that our food, our dietary and environmental factors are very, very crucial in the fight against cancer, and that we should go in and to learn from our Asian culture of Asia, Anatolia experience and Africa experience. We know we are gifted with plants, and you brought it to me when I was defending my thesis on some medicinal plants in Nigeria. I studied 10 plants intensively. I studied education biology, but I worked on 10 plants. And now that we've introduced every home a garden, I think for the winner, you should have a medicinal plant in your garden. I've decided to plant. While you were speaking, I told my staff, I said, I'm planting bitter leaf. Bitter leaf is very medicinal, lemongrass, scent leaves, and also water leaf. They are very, very medicinal, and I know the doctors can attest to that. Thank you so much for your visit. am also delighted to welcome my sisters. They've been such wonderful support for me. I will start with Madam Barbaro, because she was here with us during our inauguration. Both him and Mr. President convey our love to him. And my sister, Sierra Leone, very young and feisty. She reminds me when I was young. So every time I will remind her, take it easy, take it easy, and I love you, and thank you so much. I am glad all of you have shared different testimonies about the achievements of your countries in the fight against cancer. However, we all know that the story of late presentation, poor access to quality cancer care, is similar across the entire African continent. Therefore, this seminar afforded us the opportunity to learn from each other and understudy the advocacy programs in the region, especially among the OIC African member states. I want to commend the invited guests and indeed all participants at this high-level regional seminar who have been here since yesterday. I am optimistic that you've had fruitful deliberations and discussions. We shall await the recommendations which will be part of the resolutions of the seminar that will be communicated to the OIC African member states for consideration and implementation to address cancer prevention and early detection in our region. Your Excellencies, ladies and gentlemen, I wish to invite you to join me as we support the administration of His Excellency President Bola Ahmed Tinubu, CFR, to continue to steer the ship of Nigeria to ensure a cancer-free society. God bless the Federal Republic of Nigeria, God bless the OIC African member state, and God bless the continent of Africa. I believe we have worked so hard already. The technical team did quite wonderful, and I think we have a declaration just within the twinkle of an eye. So I'm going to read our declaration, and we will work more on it. And so I have the Abuja Center Declaration of the First Ladies of the Organization of Islamic Cooperation, African Member State, on promoting cancer awareness advocacy programs, because most of our technical teams have been with them since yesterday. So I read, we, the African First Ladies of the Organization of Islamic Cooperation, African Member States, health professionals, scientists, advocates against cancer, and other relevant stakeholders came together during the high-level regional seminar on promoting cancer awareness and advocacy programs, which held on the 15th to 16th May 2024 in Abuja, Nigeria, to raise awareness on cancer prevention and control and its prioritization at national and regional levels. 1. Recalling the Ouagadougou Declaration issued by the Special Session of First Ladies Leadership in Cancer Control in OIC member states, which held on 1st to 2nd August 2018. Acknowledging that cancer is preventable and treatable disease which poses major challenge and threats to the social and economic development of our countries. Recognizing that cancer deaths in Africa are expected to exceed the global average by 30% in 2030, and that it poses enormous emotional, spiritual, social, and economic challenges on the patients and their families with intergenerational consequences. Further recalling the resolutions and decisions adopted by successive sessions of the Islamic Conference Health Ministers, including resolution number 28 ICHM on healthy lifestyle, prevention and control of communicable and non-communicable diseases, and the health emergencies and disasters adopted by the 8th session of ICHM held in Abu Dhabi, United Arab Emirates on the 15th to 17th December 2019, which emphasized that a comprehensive approach is essential to fight cancer effectively. Recognizing the significant role of multi-sectoral partnerships between governmental agencies, intergovernmental organizations, civil society, and private sector. Reflecting on the Sustainable Development Goals, the SDGs, and reflecting on the NCD Roadmap 2023 to 2030 for the Global Action Plan on Prevention and Control, NCDs 2013 to 2030 to accelerate national responses. Based on the understanding of NCDs, epidemiology and risk actions, and identify barriers, enablers in countries. Recognizing that the further recognizes that tobacco use is one of the most important risk factors for cancer, causing around 20% of global cancer deaths and around 70% of global lung cancer deaths. Acknowledging that the breast and cervical cancer are the two common cancers, known interventions to prevent cancer. For careful planning and priorities to undertake effective activities to reduce the cancer burden. Recognizing the importance of sustainable financing for cancer prevention, control, and palliative care programs in OIC member states, especially the African region. Also appreciating the various initiatives undertaken by countries and various initiatives undertaken by OIC and its institutions and partners, including the prospect offered by the partnership between the OIC, ISDB, Islamic Development Bank, WHO, and IAEA, and other international and national organizations. Also commending the leadership of the First Lady of the Federal Republic of Nigeria, that's me, Her Excellency Senator Remi Tinubu, CON, for hosting this event, and affirming our determination to play a role in a multi-stakeholder approach in cancer prevention and control. Having listened to the various presentations, we undertake to encourage and actively participate in promoting cancer awareness advocacy programs as well as resource mobilization in our respective countries. We also pledge to advocate for the prioritization of cancer prevention and control in health agenda at both national and international level through multi-sectoral approach. We hereby call upon member states, 1, to invest more resources in addressing the risk factor associated with cancer by educating children at school to develop the culture of physical activities, healthy diet, lifestyle, launch public education campaigns about healthy diets, targeting adults, engage with representatives of the food industry to ensure compliance with guidelines on healthy diet and promote physical activities as part of everyday life. 2, encourage the participation of civil society and communities in fostering partnerships for dissemination of accurate information about cancer and provision of services for the prevention and control, treatment and care, including palliative care. 3, integrate cancer prevention into primary health care system and promote greater public awareness about the importance of cancer preventive measures. 4, strengthen implementation of early detection and screening programs for women which focus on breast and cervical cancers, which are the most frequent and detectable cancers. Cervical cancer is even preventable. 5, embrace tobacco-free OIC initiative by participating in the training and capacity building programs to facilitate the development and implementation of sustainable national tobacco control strategies in the OIC member countries in line with the guidelines set by WHO Framework Convention on Tobacco Control, recognizing that tobacco is the main cause of cancer. 6, develop and strengthen population-based cancer registry like is done in the Gambia, and scale up national cancer control program that meet the increasing need for health promotion, prevention, early detection, diagnosis, treatment, palliative care, and rehabilitation to ensure that no one is left behind. 7, promote and coordinate an integrated approach to addressing NCDs through the application of evidence-based high-impact intervention to optimize available resources. 8, share regional best practices and promote regional coordination mechanisms in cancer registration, cancer control planning, referral pathway, and implementation to strengthen health systems. 9, strengthen national capacity for research and development, including research infrastructure, equipment and supplies in research institutions, and the competence of researchers to conduct good quality research. 10, improve access to appropriate technologies with support of relevant partners for the diagnosis and treatment of cancer to promote early diagnosis and treatment. 12, report to Islamic Conference of Health Ministers on the recommendation made to strengthen national health system to ensure sustained delivery of effective cancer control programs, including high-quality cancer registration, which will guide adequate intervention. OIC General Secretariat, relevant OIC institutions and international partners to 1, coordinate with relevant partners to support member states in their efforts to prevent and control cancer and mitigate its impact by providing technical assistance and capacity building for the national health systems. 2, support public awareness events on cancer organized by and under the patronage of respective First Lady of member states to effectively address the cancer menace. 3, strive for strengthening cooperation between OIC member states in line with the prevention and control of diseases thematic area of the OIC Strategic Health Program of Action, SHPA. 4, strengthen the capacity of the Secretariat both to support the implementation of cost-effective intervention and country-adapted models of care and work with international partners to harmonize the technical assistance provided to countries for cancer prevention and control. Finally, work with member states and collaborate with global and regional cancer control organizations such as the Union for International Cancer Control, an African Organization for Research and Training in Cancer, non-governmental organizations, private sector entities, philanthropic foundations, and academic institutions to develop partnerships to scale up cancer prevention and control, and to improve the quality of life of cancer patients in line with Sustainable Development Goal 3 and 17, as well as OIC 2025 Program of Action. Thank you so much for your time and for listening. This is our declaration